Welcome to Hands on Health, the podcast all about living your healthiest life on the coast. I'm your host, Felicia Struve. My guest today is Michele Abrahams. Michele has lived with heart disease for many years. She volunteers her time to support and educate other women who have or are at risk of heart disease. Today, Michele shares her heart story and the reasons why she makes keeping her heart healthy a priority. Hi, Michele. Welcome to the podcast.
Thank you for having me today.
Well, I am excited to talk to you because I think you and I have been working together for, well, as long as you've been running WomenHeart. Is that about 7 years?
Yes, it is. Actually, I was sent to the symposium by Dr. Rinkovich in 2013, October of 2013.
Oh, so yeah, about 7 years. So can you tell our listeners a bit about WomenHeart? What is it, and what are you doing with this program?
WomenHeart is a group of women who have all gone to the Mayo Clinic to a symposium that has taught us how to be volunteers, to either run support group networks or to go out into the communities where we live to educate women about heart disease. It is an organization that started in 1999 by 3 women who all had heart attacks and all were misdiagnosed more than one time prior to their heart attacks. And they decided that it was important to start doing some studies and advocate and educate women about heart disease because they should have been diagnosed prior to their heart attacks, which would have, of course, made their lives a lot healthier. And so we just are a group of, there's about 950 of us across the country that have gone and got educated and trained to be volunteers in the communities. What we're trying to do is bring support and education to the 48 million women in our country living with or at risk for heart disease. This is the only peer-to-peer patient support group that is out there, meaning that all the women that have gone through the symposium are women that are living with heart disease themselves. The support network coordinators provide heart health education, connection, and support through monthly meetings.
And you do a monthly meeting here in Astoria, correct?
We do. Columbia Memorial Hospital since 2013 has been a hospital alliance with WomenHeart, and they have allowed us to hold our meetings, which are the third Wednesday of the month at 6:30. We were holding them at the Coho room at the hospital, but since the pandemic, we have now moved to all virtual meetings through WomenHeart. So we do them over Zoom on the same days, the third Wednesday of the month at 6:30.
Are you getting more new people who are joining because maybe the barrier for entry is a little easier, a little lower for coming to an online meeting? Are you meeting new people during all this?
We have had a few new people joining us. We have also been trying to help the women who have been with us for the last 7, 8 years and encouraging them to continue to join us over Zoom. The Cardiac Rehab Columbia Memorial Hospital has continued to provide information to the women that are coming through their clinic about WomenHeart. And so we are still seeing some new members join us. Of course, it's been a bit harder also with the pandemic, and everything that you see and read is about COVID-19, which is understandable, but it doesn't mean that heart disease stops during the pandemic. It's still a very important thing to support women with, educate women, and just try and do our best to help them through this trying time.
Yeah. Well, so heart disease. What is heart disease, and how does it affect women differently than men?
That is a great question. Heart disease is generally, if you have hypertension, which means high blood pressure, you are at risk for having heart disease because the blood pressure is not optimal for your heart to function. It also can increase chances of having, if you have high cholesterol, it increases your risk for having heart disease. Diabetes also increases your risk for heart disease. There's so many different forms of heart disease, so it's kind of hard to give a rundown of all of them. But basically, it is just where your heart is just not functioning at the optimum level that it should be. Um, Sorry, my dog's barking. So it is just really important to make sure that you are being checked first by your primary care physician. So you need to continue with those appointments. Then, if you are not feeling well, the difference between men and women is that women tend to go to the doctor and be told that, oh, you're just stressed. Oh, you just have anxiety. Oh, you're just depressed, even though they may be presenting with heart attack warning signs. Because typically for a man, it is the extreme pressure or pain in the chest and the right arm and just overall not feeling well. Well, of course, then they go ahead and say, oh, let's check you for a heart attack. For women, they tend to not present the same as men. You may have chest discomfort, not necessarily pain, or just like the pressure in your chest. You also may have upper body discomfort in both of your arms, not just the right side, in your back or in your neck. Also, women seem to present with their jaw, having pain in their jaw. Shortness of breath is a sign of a heart attack without chest discomfort. Also, dizziness, lightheadedness, or fainting is a sign that women do present when they're possibly having a heart attack. Cold sweats, vomiting, nausea, feelings of anxiety and fatigue, weakness. So I can understand how the doctors may look at it and say that women are, you're just stressed, you're just anxious, you're just so many different things. But it is up to us as women to say, no, I want you to do the test, same tests you would do on a man if you're presenting with these signs, because that is the only way that it's going to get detected prior to a heart attack happening. A heart attack is kind of like a stroke. If you can, at least in the beginning of the warning signs, do some of those preventive things, give you an aspirin. There's medication that they can give you to try and reduce the damage to your heart, because what a heart attack does is damage your heart, and then you will have more problems in the future.
So it seems like these are really vague and really broad. I can see how I myself, excuse me, if I were just not feeling well, I might say, "Oh, I must have gotten a bug," or it must be this thing that's coming up in my life that I'm just worried about. It's easy to write off the symptoms, isn't it?
It is. It really is. And that is one thing that, men, when they don't feel good, everybody knows they don't feel good. It's totally out there for everybody to know. When women don't feel good, we tend to go, oh, I'm just overtired. I've been running all day, chasing the kids, bringing them to soccer practice, or cooking dinner, making sure the laundry's done. And so really it is on us. It is on us to advocate for ourselves. And because there has not been the studies on women and heart disease as there have been on men, we just have to. We have to advocate for ourselves. We have to continually, unfortunately, you have to keep going back to the doctor. You have to keep saying, okay, I'm taking it easy. I'm meditating, but I'm still having these symptoms. So we need to start digging deeper. But women do. They take care of everyone else. And that is part of why women heart support groups are so important, because women can talk to other women. We all will say, you're right, you are busy, you are overloaded, but don't forget that you have to check these things out. It may seem like it's normal, but what if it's not? The chances of, you know, we've had people from the emergency room come talk to our groups in the past, and they said they would rather send a patient away finding nothing and knowing that they're
Mhm.
okay, doing the whole workup and checking them out and sending them away okay, than having that one person not come in that then doesn't make it to the emergency
Right.
room.
Right.
And really, I mean, that's pretty harsh to say, but those are the facts. Those are the true facts about women and heart disease, is that you keep pushing it under the rug. As women, we keep just saying, "Oh, it'll get better. It'll get better." And you just can't do that because you're missing the subtle signs, because they are subtle. They aren't big wham, hit you on the side of the head signs, or when they are, your heart probably has had a lot of damage done to it by that time.
Well, I was wondering if you are interested in sharing your story.
Well, my story is different than most women, and that is what Women Heart is about also, is sharing our stories. Us Women Heart champions do go around and share our stories, which is what hopefully opens up other women to share their stories. So my story starts about 54 years ago. I was born with a congenital heart disease, which of course is different than somebody in their 60s or 70s that have now have onset heart disease. But my story is that I was born with a congenital heart disease that the doctors didn't even know about in 1966. I was brought home by my mom or my parents, and a couple weeks later, my grandma noticed that the bottom of my feet were very blue, almost black. My mom brought me back to the doctor that actually delivered me, living here in Astoria. Your OB was also then your pediatrician and all those types of things in those days. And so he then detected a murmur, but he told my parents that he thought it was more than a murmur. So he called to OHSU, Dornbecker Hospital, and told them that he had a patient that needed to be seen right away, and sent my parents in their car with an oxygen tank to drive 2 hours from Astoria to Dornbecker Hospital. Once I was there, they did determine that I have transposition of the great arteries, which means your pulmonary and your aortic arteries are switched. So the blood was not oxygenating as it should to sustain my life. A couple weeks later, they went ahead and did a closed heart surgery where they actually increased, all babies are born with a hole in their heart. And so they made that hole bigger so that the oxygenated blood would mix and be able to get out into my extremities and my other organs. And so they did that. And in those days, they weren't too eager to do surgery as they are. Now, babies have surgery sometimes in utero, sometimes, but more often than not, they wait and have the surgery within a couple months of being born. And when I had my surgery, not until 1970, so I was almost 4 years old when I had my surgery, they did what was called a mustard procedure. So they basically, instead of switching the pulmonary and aortic arteries to the way that they are to be in a normal heart, they basically created a shunt that would allow the blood to go in the correct direction and mix as it should. So I have been living with that for 54 years. The thing with most all surgeries, but a lot of times heart surgeries, once you have a surgery, even though it can correct things, it can also bring on other problems. And so, because of the type of surgery that was done, I then developed a very low heart rate at night. So, at the age of 19, I had a pacemaker implanted. So, I am now on my sixth pacemaker because they are used a lot for my heart. It uses the battery, so I've had to have them changed quite frequently. Prior to that, I had tachycardia, which is another defect or symptom of having the mustard procedure done. And so the list kind of goes on. I've had atrial fibrillation that I developed when I was pregnant with my second daughter and actually gave birth to her in AFib and was cardioverted the day after giving birth. I've had to have two ablations which is a type of procedure to try and go in and correct the AFib. And those did not work for me, but they do work for the majority of people. The difficulty with my heart is that it's just not plumbed the same way as everyone else's. And because of the surgeries I've had, I have scar tissue where a normal heart would not have scar tissue in it. So it does create a little more difficulty for the doctors to do what they would do on a normal person. I've had cardiac catheterizations. I have had different medications over the time, some that I've found I'm allergic to and do not do well with. So all of these different things that have happened to me have made it so I understand a lot when these women come through the door that have had different procedures or just in the beginning of it. I've had several stress tests, which are exercise basically that checks your heart function as you're exercising, as it's being exerted. So I've kind of ran through the gamut, but it makes for a good heart story. And for me, it's the only heart story I know. I don't know what it's like to have a normal heart. So I'm just thankful that I have had good doctoring and that I continue to live a very healthy life, especially for someone with transposition born in 1966.
Yeah, you have an amazing story. You're definitely a heart veteran there.
Yes, yes.
Yeah, and you've also lived a full life, it sounds like. I mean, you have children, you have found ways around the problems with your heart in order to have and I know just from knowing you, you're very healthy, you're fit, you definitely take good care of yourself. So, I'm sure that all plays into your success.
It definitely does. And that is one thing that women and men really need to realize that there's genetic reasons why you end up with heart disease. As many other diseases, diabetes, the list can go on. But really, what happens is you have to learn to take control and you have to decide. And I haven't always. You get busy. You eat things you shouldn't eat. You are, it was easy to run through McDonald's with my 2 kids, those types of
Right.
things. But at some point in time, after my daughters had left home and I was here, I decided, it's up to me to take control. I got a dog. I started walking. I walk anywhere from 2.5 to 4.5 miles 5 days a week. I do try and eat better. I have cut back on my caffeine intake and my alcohol intake because those things will bring on the atrial fibrillation. And that is one thing is coming to the Women Heart support groups and learning these things. It gives you tools to make your life better. I've decided that I want to be healthy. I want to live as long as I can and do so feeling well while doing it. Not all days are great and hunky dory. Some days are trying, but those are the days that you rest. Not all days do I choose to eat the right things, but everything's in moderation. And I think that is something that we all have to remember. If you cheat, have a blizzard one day, then you just don't have one the next day. Those are just important things. And it's up to you to make those lifestyle choices. Your doctor's going to tell you when you go in, but they can't make you. They can't make you choose to live a healthier lifestyle. You have to come to terms with it and know that it will make a difference. And that's what the important part is making a difference in your own life.
Do you have a reason to make those choices? Is it for yourself? Is it for your family? What's your why?
I think a lot of it is for me because the doctors don't know. I am probably one of the oldest mustard procedure patients still living in the state of Oregon. And when I go and see my doctor, they say, "Well, things look like they're doing great, but we don't know what your future holds for you." And honestly, that is true of anyone. But for me, it's always been something that pretty much stares me in the face when I look in the mirror. I don't know. And so my why is because I want to be here. I had children when actually having children was not what my doctors thought was the best thing to do. Not that it was the worst thing. I was told I would have 5% chance of my children having a congenital heart defect, and they hadn't had a person that had had mustard procedure deliver a baby at OHSU. And so I guess my why is why not? Why not choose to be healthy? Why not choose to make those choices so that you can I'm lucky. I am going to meet my first grandson in April as long as everything goes as it's planned. And that's why, because I want to live a full life like a normal person without heart disease. And so a lot of it is learning that you can make a difference in your life even though you may be given a diagnosis that is scarier than anything else. But it's up to you how you choose to come out on top of that. You can choose to do better. I know people that have gone through traumatic heart events in their lives, had terrible numbers as far as the ejection fraction, and they have turned it around. You can turn things around. I proved that to my doctors. I had had a stress test done several years ago, and at the age of 50, I had another one, and they said it was improved over when I was in my 40s because I did start walking and I did it on a daily. And I think it's the mental game too, trying to realize that you have to become healthy as a whole. You can't just dwell on things. If you're doing things to improve, things should improve. And that's the important part.
Oh, Michelle, you are definitely an inspiration. And I know for years I've been telling myself I should come to some Women Heart meetings. And, it's just like, the blood pressure's a little high. But that that's an indicator.
It is. It is an indicator. And what we want the women of our community to know is that our meetings are not just for women who have had a diagnosis of heart disease. Our meetings are for every woman. Just being a woman puts you at risk for heart disease because hormones play a big part in heart disease as well. And women's hormones are different than men's, as we all know. And so we want women to come. We want them to come. We have speakers. In January, we had a dentist come and talk to us about periodontal disease that has an effect on heart disease. And so, but it was knowledge for any woman to learn about periodontal disease. In February, we are having Dr. Rankovich come and do a doc talk. She's going to just be on our Zoom call and answer any questions anybody has. And you can't get that in many places in the community. In March, we have a counselor that's coming and talking to us about mindfulness because he's already talked to us about depression and depression that comes with getting a diagnosis like heart disease. We decided let's go beyond that. Okay, now that we've gotten that diagnosis, how can we cope with it? And learning about mindfulness. So you do all these things and you start lowering your blood pressure and you start lowering your cholesterol. The one thing I've learned is your body works together. And so having it as well tuned in all aspects, your heart and every other organ in your body is going to be better for it.
Well, definitely you're making a good case. Well, I really appreciate you taking the time to chat with me today. I appreciate what you're doing for the community. It's so important. And your own story, you've got a grandbaby coming. That's so exciting.
It is. It is very exciting. And we are very lucky that Columbia Memorial Hospital has continued being a hospital alliance. Dr. Rankovich has been a champion in our community about getting heart health awareness and helping those women with heart disease and men in our community. But I remember her coming on the scene about 10 years ago and seeing a big billboard of her as I'm driving into town and thinking, yes, Finally, we have a woman doctor that is going to do something to make a difference for the women of our community. And she was a champion behind this, of getting a support group here for our community, and us women that come faithfully every month thank her and cannot thank her enough, because having the support of women that are going through the same thing as you are, it makes all the difference in the world.
Well, thank you. And we are very blessed with Dr. Rinkovich. She is one of the experts in women's heart health. So not only is she a great support to the women in our community, but she's got the knowledge there too.
She does, and she's fighting for us women and getting us in studies, and it can only get better from here.
Yep. Well, thank you.
Thank you very much, Felicia.
Thank you for joining us today. I'm Felicia Struve, and this has been an episode of Hands on Health, brought to you by Columbia Memorial Hospital.